Good afternoon. As you heard, my role is to come sort of to the working level of SNAP and SNAP-Ed. And so what I'm going to be talking to you about is a little on-the-ground experience and then how the recommendations in this report could really help to improve the program. My background, as was mentioned, is that I have worked in anti-poverty programs from the beginning of my career, cancer prevention, and now, most recently, low-income social marketing campaigns. To reiterate a little bit, I'm going to talk about SNAP-Ed because that's an area of SNAP that is little known. And so I wanted to be sure that there were some basic understanding. While we target SNAP participants, the rules allow for us to serve persons up to 185% of the federal poverty level. And so that expands the number of people whom we can target. And this is important because people cycle in and out of SNAP. And in our state, the average participation time in SNAP is about 10 months. So that you see people coming in and out. It's not the same as a WIC program where you come in at hopefully the beginning of your pregnancy and you may be with those children until they reach 5 years of age, going back to WIC. So there are some fundamental differences. As you heard, the history of SNAP is such that it began as a way of getting calories. And then in the mid-90s, USDA started looking at the chronic disease prevention areas, and that's when I began to get involved. And then just in 2010, with the Healthy Hunger Free Kids Act, it started to focus on obesity. So it's taken on more kinds of roles than it had before. SNAP-Ed itself has been in the legislation since 1981, but it was not until about 2004 that all of the states were offering SNAP-Ed. It's an optional activity in states, and until 2010, you had to raise money in order to qualify for federal matching funds. And for many states, that was very difficult. The thing that, the program, SNAP-Ed right now, is funded at about $400 million through 2018. It is no longer a federal financial participation incentive-based program. It is now a capped program, and that was part of the economic savings that were negotiated a couple of years ago. So what you see is the nutrition education part of SNAP is 0.5% of the total budget. Now, this does contrast with other programs, but the thing to me that this report really highlighted is that SNAP-Ed is the only component of the SNAP program right now that focuses on nutrition. And so we have a supplemental nutrition assistance program that 0.5% is focused on nutrition. So that's why I call SNAP-Ed an emerging strategy. And as I mentioned, it's only relatively recently that all the states are doing SNAP-Ed. It was pay to play, and so that was a deterrent for many states that didn't raise the soft match that was required. The budgets in states range dramatically from less than $100,000 for an entire state to at least one state where over $100 million was raised. And so that, you can see, would affect the kinds of programs and the kind of results that you would expect to see. SNAP-Ed targets 70 million lowest income Americans, and the activities, as you can imagine, vary from small community programs. There's programs in a few schools, all the way to statewide initiatives. And as I mentioned, we moved from an incentive type funding to a grant program, and there'll be reallocations so that starting in 2014, the states that have more SNAP participants will begin to have their budgets adjusted upwards, whereas by 2018, there'll be a different kind of funding formula. The competition that we're up against, you're very familiar with, but I wanted to put it in dollars and cents. There does seem to be an increase in food advertising. In just the 10 years that I looked at, I had a hard time finding these numbers, but you can see that going from about $7 billion for food advertising to $11 billion in just 10 years is huge. And again, remember I told you that SNAP-Ed is about $400 million. So this is against now $11 billion. 90% of the typical food marketing money is for less healthy foods, only 1% has been calculated in a number of different studies to go for fruits and vegetables. The thing that's important about this is that generally less educated people are less able to navigate health claims and marketing, pricing strategies and so forth, so that SNAP participants are going to be by definition the most susceptible to marketing techniques. And we do know that disparate marketing goes on with non-English speaking communities, with African American communities, kind of the same things that you see with tobacco, with trying to reach groups that are vulnerable. So nonetheless, a lot of times we're here, well, can these programs work? And the answer is an unresounding yes. I want to mention that the states submit all of their research that they've done every year to USDA, so there is a compendium of research, but these are some of the bigger ones that I wanted to highlight. In California, we were able to increase the consumption by low-income consumers of fruits and vegetables to reach goal by 90% in the space of 10 years, and we did very well with SNAP participants. So the point being here that if you do a campaign that works, it's well organized, you can get these numbers up. In Philadelphia, a different program worked with schools, low-resource schools. It used SNAP interventions and funding from CDC. They had really good results on reductions of incidence of overweight and obesity. And there we were moving into the health changes. In Massachusetts, I think most people are familiar with Shape Up Somerville, but there they had both positive behavioral and health outcomes for entire low-income community. And that those last two were funded partially by SNAP, the interventions. Or SNAP Ed, I should say. And then, of course, most people are familiar with the VERB campaign that CDC did, which showed that mass marketing, public relations, and so forth, when combined with community programs, actually increased physical activity rates substantially in tweens. So these programs can work. They just have to be done right. So the way that SNAP Ed works is that it's controlled by guidance that the USDA releases pretty much every year. And because of Healthy Hunger-Free Kids, there was new guidance developed that will take effect October 1st. It addressed many of the concerns that those of us practicing had about the program. One was what we call the gag order, on not being able to say that you should eat less of anything. So now we can talk about the limiting of unhealthy foods. You can see the list here of advances that are made in the new guidance. And so I want to talk about those a little bit more in terms of the future. But what this is going to do, I think, is allow SNAP Ed to be more effective than it was able to be under old guidelines. And it uses a lot of the public health and large-scale, scientifically based approaches that we have only been able to partially use in the past. Basically, we'll be able to combine education with marketing, with policy systems, environmental change, and that's a powerful combination. So in terms of the recommendations that are in this report, I want to highlight 3 from SNAP Ed and then 6 that are more general to the SNAP program. Number 1, we have a very good evidence base from the decade and a half of SNAP Ed, mainly the last 10 years. And so this evidence needs to be harvested so that it can be shared with social service agencies, with all kinds of agencies that are engaged for the first time, will be engaged as this funding shifts the way that I described. So that this is, in a way, it's a giant experiment, and we have an opportunity to reach into the Southeast, for example, and to reach into other states where they can learn from the experience and be more successful and build on what is already known. The state SNAP agencies, for the first time, are getting involved heavily in SNAP Ed. And so this is, SNAP, as you heard, is a social service model. It isn't a public health model. So that there needs to be a cultural understanding between, say, health, education, and social services. How can that happen? State exchanges are customary in government, but I think there needs to be some more leadership in that area. We have a lot of momentum on childhood obesity, particularly obesity generally, childhood obesity particularly. We can capitalize on that. We need to be able to collaborate with other funding streams, particularly Centers for Disease Control with community transformation grants, but other kinds of programs. There have been barriers to working together, and so we need to break down those barriers. And one of the barriers is the cost allocation scheme, where you have to figure out what proportion of people are SNAP-Ed qualified and you pay for only those people. And that is a barrier to partnership. Targeting has been a real issue in SNAP-Ed. You can see some statistics here about the targeting using census tracts meant that we were by definition excluding as much as 75% of the SNAP-Ed eligible population, because we could only go into census tracts where over half of the people were at 185% of the federal poverty or lower. And so by definition, this was the University of Hawaii did a analysis, and this is the number that they came up with. So you're really not going to be able to change these numbers if you can only reach 25% of the people. It is similar with the free and reduced price meal program in schools, where you can only work with schools that where over half of the students qualify for free and reduced. What we found in our worksite program is that the worksite standards are also very difficult. So if you think about worksites being to adults what schools are to kids in terms of being able to reach them effectively there, we can't get in with the current kinds of targeting standards. Mass media has also been an issue. We have to meet over half of the viewers, or the audience must be below 185. There aren't really good outlets in that way in Lillian's Arena. So those are the kinds of things that would make a very big difference if we use more business approaches to targeting, where you recognize you've got a consumer segment and you design your programs for that consumer segment and then deliver them the best way that you can. Reporting systems. The SNAP-Ed has been questioned by Congress as to whether we were effective or not. And so the development, as you can appreciate, of a reporting system for such diversity around the country is very complicated. Now we have the opportunity to really design a reporting system where we can harvest the results of the good work that's going on, share credit with the social service agencies, with the charitable organizations, with the other government agencies that are contributing to this, because it's going to take all of us with our shoulders to the wheel, but we want to be accountable to our funders. So we have to figure out what that reporting looks like. The current reporting doesn't capture everybody that we actually reach. It underreports dramatically. It doesn't report on behavioral, organizational, community, or statewide outcomes. We're just counting people, and we're counting things. We don't show how, it doesn't show how we work with others. And that's very much what it's all about these days, right? It's all about collaboration. And it's all about working together and solving big problems. And so basically, the reporting system is one that we have to work on for the future. And so moving then to the main report, these are ways that SNAP itself could be changed so that it would support better nutrition. Just one of the top areas is lower the cost of healthy foods. Well, how could that be done? We know that SNAP shoppers are very price sensitive, and that the cost of healthy food has gone up this decade. It didn't used to be, but it is now. And so what the recommendation was already made, and I want to second it, that grocery stores should be allowed to offer lower prices for healthy food to their SNAP customers. Right now, they may not have a higher price or a lower price. And so to me, there's no reason that if a grocery store wants to offer specials of fruit in season or vegetables in season or anything else that's healthy, there should be no reason that they can't do that at their own expense, but they're not allowed to. I would suggest that these be only, though, the healthy, under-consumed basic foods. We need to offer SNAP customers healthier choices. Much is known about food deserts and food swamps. Did you know that 160,000 retailers are certified for SNAP? It's a huge number. In our state, we have 18,000 SNAP certified stores, 6,000 are WIC certified. And as you know, WIC has that food package, and you must have stocking standards. So you can see the difference, 6,000 versus 18,000. So there may be some room for improvement in the stocking standards. So what the requirements are right now is that retailers have to stock only 3 items from each of 4 basic food groups, and out of that, 2 have to be perishable. So that means that there don't have to be any fresh fruits or vegetables in a SNAP certified store. Is that a good thing? Probably not helpful. Next is that what we're seeing is that EBT signage is being used in a way that encourages people to buy unhealthy foods. You may have seen some, and I'm sorry I don't have some slides here that would be much more visible, but huge signs outside convenience stores with EBT on it here with tall, oversized soft drinks. If you go down the aisles of some stores, you'll see those shelf signs sticking out that say EBT. Well, what are the aisles? The aisles are salty snacks, candy, and soda. So that cue to action is that EBT signage. So what is the reason that EBT signage couldn't be limited to healthy foods and prohibited with the unhealthy foods? Increasing SNAP benefits. We've talked a lot about that today, and in this climate, it's very hard to talk about raising the SNAP benefit. But the point here as well is that there are big differences in food costs around the country. And so there are some areas where the SNAP benefit goes a lot farther than it does in others. So would it be possible to try to make regional adjustments, at least for the food prices? And then we've already talked, or I think we have, about the idea of special packages for kids. In my state, summer programs are on the wane because of the education problems in educational funding. So these kids are without food during the summer. And so the summer meals program is a really important strategy. It can be very modest, but it can make a huge difference so those kids come back ready to learn and they haven't, and they're not poorly nourished. And then I think this is my last one, the purchasing data. We all want the program to be accountable. We want to know that the foods are being spent, that the money is being spent well. But from a nutrition education perspective, we really are working in the dark when we don't know what the purchasing data are in the different stores that we're working with. We don't know if our campaigns are working when we don't know whether the food purchasing is changing. Nor do we know the comparison between SNAP shoppers and non-SNAP shoppers in the same store. So it would be incredibly valuable for these data de-identified, so there's no stigmatization or penalty or anything like that. But it's really very important for us to have real-time data, and I would compare that to tobacco tax money, because when you do a tobacco campaign, you can see what the taxes came in, whether they went down because sales went down. We have nothing comparable like that in this field, and we need it. So finally, we've talked a little bit about innovation and modernization. I was affected when I first started working in this program in the late 90s with a PBS special called Crossing Death Valley. I don't know if anybody remembers it. But it talked about the challenges that USDA had in taking its innovative programs and getting them out to the field. And I think that this is the kind of thing that we're really talking about here, where we have a very complex problem. For example, a simple thing like a 30% incentive delivered at point of sale on an EBT card for fruits and vegetables is very difficult from a banking, a computer, it's a very difficult thing to do. And so it feels like we really need to have some way at USDA where this kind of innovation is nurtured and cultured and disseminated. That would make a huge difference. So a couple of other things is that USDA could put nutrition as a performance standard for states. Instead of just fraud and abuse, these kinds of performance standards, there could be a standard for nutrition or for food security to make sure that there's an incentive built into the state agencies and those that they work with to work against the goals and the mission of this program. We've talked about waivers. Waivers are incredibly difficult to get, and there may not be the authority for them. So the whole waiver idea for these states as laboratories of innovation is really important. The idea of a SNAP package for kids could be tested. Be a great idea. And so the takeaways are that SNAP-Ed is important, but it's not enough. I think needs to be grown, it needs to be strengthened, but it has to have these other elements to actually turn the program around. There's not one thing that's going to make a difference. These are all interrelated and interconnected, and they will have synergy if you put them together. The recommendations do need to be science-based. We've tried to do that in this report. We've tried to make them as inexpensive or revenue neutral as possible to get more value, as you were hearing from the senators. And they would increase our return on investment, especially focusing on children.